Hello everyone. Welcome you all to the Master Nursing classes. Good evening to everyone. Sagadala Namaskar. Ellarigu Namaskara. Once again, welcome you all to the Master Nursing classes. In the last 5 classes of the crash course, we have discussed the most important questions. Since from the very basic to the very advanced, scenario based questions, the practical based questions, the image based questions, and all possible very important and high yield contents we are covering. And the hot topic where there is chance of the 2 to 3 questions will be there, that kind of the questions we are covering in detail. Like I have covered entire ECG from zero to complete basic, because there is chance of the 3 to 5 questions will come from the topic of the ECG. So I have covered that one in detail. And our pediatric sir Raghav sir is covering the uh, very high topics from the pediatrics. Sir have scheduled the classes on the IMNCF. Very important. There is 2 to 3 questions chance will be there, like how to manage the cases by the IMNCA criteria in the pneumonia, in the diarrhea. Okay, so everything sir explained very nice. And chance of the questions from the neonatal resuscitation, very high topic. That one also sir have scheduled. Okay, so part 1 video we have already released in our YouTube, and part 2 will come very soon. And non-nursing part also covered by the our Mr. Sunil Uji sir, the legendary talent in the non-nursing. So they will cover the syllabus which is required to your RRB and Norcet prelims also. Okay, so what you all people have to do is the take a note of it. Okay, so make it revise, at least 2 times revise it. And while delivering the any content in the class, okay, so I won't write everything because it is short duration of the time, and I want to deliver all the golden points, whether that you people won't miss anything for your exams. Okay, some points I will tell clearly, like this is the question, this will be the answer, or that one you people can note it down while listening for the class. It actually helps. Okay, so it matters a lot in your rank also, right? So without wasting the time, we will start the today's class. And thank you so much for the huge response from all over India to the last classes. Okay, so this is what actually a teacher want, right? So the today's class will be start with a beautiful motivational quote, that is, the future depends on what you do today. The future will be not predicted what will be done tomorrow. If you are doing something today, if you are working on your dream today, so the today is the thing which makes and which creates the tomorrow, right bacho? So don't depend on the others, don't depend on the unnecessary things, don't attract by the temporary perfections. Be disciplined, be motivated, work on your dream, so that actually pays one day, definitely, right? So the nothing is impossible. The word impossible, it is itself telling it is I am possible, right? So you can focus over here, I am possible. Okay, if you club it, it is impossible. If you look in a positive way, it will looks like I am possible, right? So it's very important bacho to be updated, to learn the important things. So stay connected with the class till the end, watch the class completely till the end. So from the today's session, there is definitely chance of the asking at least 4 questions, directly, indirectly. Okay, so it's most and high yield contents I have covered in the today's session. Don't miss the anything. Okay, take a note of the anything, everything. At least take a screenshot and revise immediately after the class and delete the all screenshots. Okay, so it's very important. So the class will start with a very important update, that is World Health Day of the 2024. We have celebrated this one on the April 7. So every time April 7, we have to celebrate the World Health Day. Okay, which will be organized by the our World Health Organization. Okay, so this is 2024 April 7. This is the World Health Day. We have to celebrate every year. Important. And the theme of the World Health Day 2024 is the My Health, My Right, or the theme of the World Health Day 2024. And the next one is the World Health Day 2025. Very important, bacho. Okay, so this is also same as a 7th April we have to celebrate, and this is the theme of the 2025 World Health Day. Take a screenshot of this one. Okay, so that is the healthy beginnings, hopeful futures. So this is the theme of the World Health Day 2025. Okay, it's very important for you all, right? And here is the first and very important question. Okay, very important first question. So do read the question completely till the end carefully. Okay, so all you people have to choose the sequence of the donning of the PPE here. Okay, very simple question. So what is the sequence in the donning of the PPE? What is the donning of the PPE? So there are two words, donning and doffing. Okay, donning means wearing the personal protective equipments, and doffing means removing the personal protective equipments. So that is what you call as the donning. Donning is the wearing the personal protective equipment. While wearing the personal protective equipment, what is the sequence all you people have to choose here in this question? Okay, so option A is telling the gown. First we have to wear the gown, then we have to wear the gloves, it is telling. Bacho, always remember gloves will be wear at the last. Okay, it is always wear at the last. Very important. So I am eliminating this one. Right? So option B, first we have to wear the gown. Sorry, gloves it is telling. If I am wearing the gloves, then after I am wearing the gown, means the gloves will get contaminated. And just now only told the gloves will be always wear at the last. Okay. Option C is telling it's first we have to wear the mask, then gown, then gloves, then face shield. Again, the gloves is coming here. Bacha, if you are wearing the gloves, along with that gloved hand, you are putting your face shield and goggles means again gloves will get contaminated. I am just telling with the tricks that all people have to apply in the exam. Okay. So this is I am eliminating here. So then comes to the option D. The gown we have to wear the first. Yes, this is how to wear the first. Then I have to put on the mask and respirator. Okay. So then the face shield and goggles. At last, gloves should be wear. So this is your correct answer. And almost all you people have chosen the correct answer. Yes, but a very good evening. Very good evening. So please share the classes to your WhatsApp status, so that will help us, right? So this is the correct answer for this question. Okay, so always remember beta, while choosing the sequence, be careful. Okay, so just with the tricks you have, all you people have to remember, first starts with the gown and last ends with the gloves. Okay, so these tricks you apply and eliminate the option. If still you create the confusion, remember the second sequence that, so after gown we have to wear the mask. Okay, so that is the good morning. Very important. All you people have to create a sequence like this. Okay, it's important. Then comes to the next question. If you accidentally touch the outside of your sterile gloves, bacho, while wearing the sterile gloves, we should not touch the outside part. Okay, so outside part is the completely sterile one. Okay, this is the outside part, right? So this is the completely sterile one. With that gloved hand only, we have to create the, and we have to do the some sterile procedures or some sterile surgeries, right? So if I accidentally touch that one with my bare hand, what I have to do? This is the scenario practical question. Okay, so the question may comes in your exams. If you accidentally touch the outside of your sterile gloves, so while wearing them, what you have to do? What should be done? Option is continue wearing. Same, you continue the same clothes wearing that. Nothing has happened. No. If you wear that and the patient will get any infection, means it may create the hospital acquired infections. That is the surgical site infection. Don't wear that one. So that is the, I am eliminating option A. Right. So then comes to the option B. Option B is remove the gloves and put on a new pair of the sterile gloves. Yes, option B is telling we have to remove the old gloves and put on the new sterile gloves. Okay, this is the correct answer for you all, right? So this one is the correct answer. Then option C, disinfect hand and continue wearing them. No, here the hands are not contaminated. Here the gloves are contaminated. Yes, after washing our complete hand only, we are came here to wear the sterile gloves. But we have touched the sterile gloves accidentally. Means the gloves is contaminated. So there is no sense in the making the hand disinfection here. So I'm eliminating the option C here. Then comes with D, rinse the gloves with the sterile water and put them back. Option D is telling we have to wash the gloves with the sterile water. Now it again creates the contamination. So don't do option D also. Yes, what we have to do is the just we have to remove the gloves and put on the new pair of the sterile gloves? It's very important. Okay, important question. And last one, sequence. Very important question. Okay, so remember, in your one famous competitive book, the sequence which was given is incorrect. Okay, I will tell the sequence what to do while wearing the sterile gloves. Remember this one only, apply this one only in the exam. Believe me, the rank will come. Believe me, the rank will come. Right? Yes. So while wearing the gloves, first we have to wear on the dominant hand. First we have to wear on the dominant hand. Okay. So to wear the gloves in the dominant hand, hold with the non-dominant hand. This question, this word or the sentence also will come and students will confuse. Okay, hold the first gloves with the non-dominant hand and wear the gloves in the dominant hand first. Okay, so to first we have to wear the gloves in the dominant hand. Very important. So second one, of course, the non-dominant hand we have to wear. This is while wearing the gloves. While removing the gloves. Okay, so while removing the gloves, first remove from the non-dominant hand. First remove from the non-dominant hand. It's very important, bacha. Wearing first is the dominant hand, and while removing, first one is the non-dominant hand. Okay, so it's important. And there is a technique while removing the gloves. The technique is called as the gloves to gloves, skin to skin technique. What it means? While removing the gloves, okay, the gloves are now contaminated, right? So both gloves we have used, and then after using only we are removing the gloves, right? So both gloves are now contaminated. So how I have to remove the gloves? That is by the gloves to gloves technique and yes, the skin to skin technique. Consider I have the gloves in this hand now. Okay, I am removing the gloves, right? So I am removing the gloves means this hand also having the gloves and which is contaminated, and this is also having the gloves. This is contaminated. Now with this gloves hand, I will hold yes this gloves only, and I will remove the gloves like this. Okay. Remember, while removing non-dominant hand, I have to remove first. Okay, this is my left hand. So this is my non-dominant hand. I am removing the gloves from here. Okay. So now this hand is gloves free, and only hand is there. There is no gloves because I have removed the gloves and I have holded this gloves in this hand. Right. So while removing this hand, what I have to do? This is my skin. Okay. Now I have gloves on this hand plus gloves in this hand. Right. So while removing just now, I have to use my hand and remove while holding the inside, and I will move this one like this, and in that inside part should come outside. Okay. So peel the gloves. That inside part should come outside. Okay. Here I am using skin to skin technique. Right. So very important. While removing the first gloves to gloves technique, while removing the second glove, skin to skin technique. Very important. The gloves to gloves, skin to skin technique is used while wearing the while removing the gloves. Very important technique. Okay, practical question that may comes in your exams directly. Okay, so yes, this is a beautiful 30-second advertisement for you all. That is from the master nursing classes. All of you know that we are having the test series for the RRB. That is the Vande Bharat Express series. And second one is the Norcet booster series for the Norcet. And for both combo, we are having the sure selection test series. Okay. From all these Vande Bharat, Norcet 8 and sure selection test series. From all these test series, we are giving a beautiful discount on behalf of the Ugadi. Okay. So here the Ugadi 15 is the coupon code we have created. Okay, so before purchasing the any kind of the test series from the master nursing classes, please do apply this test this coupon to get the 15% extra discount on the prices. Okay, so if you want the test series is the perfectly designed according to the syllabus, including the nursing, non-nursing. Okay, according to the syllabus, completely based on the exam patterns, same to same situation you people going to experience in our test series. The link is given in the description box related to the master nursing classes. So if people have to download the master nursing classes from the Play Store, and the courses will come in front of you all. So when you open the app with your login by your mobile number, so whichever is comfortable for you can purchase that one and practice that one. Very importantly, the sure selection test is for both Norcet 8 and RRB. Okay, if you want only prepare for RRB, the RRB separate is also there. If you want for only Norcet, Norcet separate also is also there. Okay, yes. So here is the next question. So what is the correct order of doffing the PP? Okay, just we have discussed the donning in the previous question. Here the doffing is now. There only I told the donning is wearing the PP. The doffing is removing the PP. Okay. So what is the correct order of doffing the PP? Okay. So here we have discussed donning, right? First one. Now here is the doffing, right? So yes, let me read the options and clarify you. But there I told the gloves should be wear last while donning the PP. Remember the golden point again. While removing the PP, the gloves should be removed first. Gloves को last में wear करने हैं, first में remove करना है, right? So what is the correct order of the doffing PP? So first one all we have to know is the gloves should be removed first. So option D I am removing because here it is telling mask is the first. So I am removing option D directly. Then comes to the option A, the gloves we have to remove. After that, face shield we have to remove. Then after that, gown we have to remove. Then after that, the mask and respirator we have to remove. Is this correct sequence? Yes. So the option B is telling gloves we have to remove. Yes, gloves we have to remove first, right? Then after mask we have to remove. Then face shield we have to remove. Then gown. But you consider this is the mask will be there here. The face shield will be here. So I have removed my gloves. Directly, how can I remove my mask? I have to remove face shield first, then only I can remove the mask, right? So with face shield, I can't remove the mask properly. Okay. So very importantly, after the gloves, we have to remove the face shield. Okay. So after the gloves, we have to remove the face shield first. Okay. So we have removed the face shield and goggle. Then we have to remove the gown. Okay. So then we have to remove the mask at last. Very importantly, remember this sequence is the correct one. Option A is the correct one. Okay. B I am eliminating. Then option C is telling gown we have to remove first. No, gown we won't remove first. First we will remove the gloves. Okay. So it's very important. Then comes to the yes, it is eliminated here. So I'm not going to waste your time more. So this is the correct sequence. That is the gloves remove, then remove the face shield and goggle, then remove the gown, then remove the mask or respirator at last. Okay, this is the correct sequence, right? And remember some golden points while removing the gown. So we have to hold it from the inside, okay, because the outside one is contaminated because we have done the procedure just now. Okay, so it's very important, and all or designated biomedical waste, all people have to remember. It's I told in already the third class, I think. Okay, so in the third day class, I have told all biomedical waste management, and very important and golden point chanting also we have done with the on like by hand experience, like, right? So that one also you can watch if you have still not watched that one. Okay, yes. So here is the next question. So when using the physical restraints, which of the following assessment should be performed regularly by the nurse while using the physical restraints? Which one we have to perform regularly as a nursing officer? Option A, blood pressure and oxygen level only. It's telling only blood pressure we have to monitor and only oxygen level we have to monitor. No. Then comes to the option B, skin integrity we have to monitor, circulation we have to monitor, and comfort we have to monitor. Yes, we have to monitor this one. Then comes to the option C, respiratory rate and temperature we have to monitor. So only not this much is required, but they have asked for the restraints here specially. So the answer goes to the skin integrity we have to monitor regularly, and the circulation we have to monitor regularly, and comfort of the patient we have to monitor regularly. Okay, and continuously keep the patient under supervision So how frequently you have to monitor the patient? Every 30 minutes we have to assess the patient on the restraints. Okay, so what is restraints? I think all people know this one. So restraints is the, yes, immobilizing the patient by using the physical method and by using the medical medicines. Okay, restraints is the immobilizing the patient. Why we are immobilizing the patient? Like in the, especially in the psychiatric conditions where the patient is very agitated and the patient may harm other patient in the ward, or the patient may self damage. Okay, so he can damage himself. So at that kind of the time, we have to use the restraints. Okay, but you remember the golden words: before applying the restraints, we have to take a consent. Okay, and once consent taken, it is valid for, once consent taken, it is valid for only 24 hours. Okay. After 24 hours, if you want to maintain the restraints, again means you have to take again the consent. Okay. So only once consent you have taken means it is valid for the only 24 hours. Very, very important. So then comes to the, if we apply the restraints to the patient, then don't keep the patient in the private rooms and the room which is very much away from the our main station, means main nurse station. Why? Because sometimes the patients, the biological needs may arise, just like the patient may wants to go to the washroom and you have tied his hand and your patient is calling, you are not assisting the patient, so it may leads to the, yes, unnecessary complications, right? So we have to assist the patient every 30 minutes. Okay, and we have to assess the all basic needs of the patient, very much important, because we have restrained the movement of the patient here. Okay, and admit the patient near to the your nurse station. Okay, if you are applying the restraints, very, very importantly. So then comes to the next very important point on the restraints. If you have applied the restraints, okay, like consider this is the hand. So in order to reduce the movement of the hand, you have applied the restraints here, means you have to check the circulation which is distal to the restraints. Okay, so you have tied the restraints here, means you have to check the circulation here. Okay, so how you have to check the circulation? This is what you call as the distal part. Okay, so जो बॉडी से दूर होगा उसको डिस्टल बोलेंगे, जो बॉडी को नियर होगा उसको बोलेंगे हम प्रॉक्सिमल. ओके, बॉडी को पास है तो प्रॉक्सिमल, दूर है तो डिस्टल. Yes, let's repeat. If it is near to your body, that is what we call as the proximal part of the body. If it is away from your body, we call that one as the distal part of the body. Okay, so if you are applying the restraints here, where you have to see the circulation, yes, how is the arterial supply happens? Arterial supply happens like this, right? Means if I am applying the restraints here, so then I have to check the circulation here, distal to the restraints. Okay, the question will come. So check for the capillary refill time proximal to the restraints, and the option B will come, the check the capillary refill time distal to the restraints, where you have to choose the answer that is distal to the restraints. So we have to check because the arterial supply may block behind the our restraints application, right? So we have to check the capillary refill time. So it should be less than 3 seconds. Okay, what is the capillary refill time? I am pushing over this nail. Okay, the all capillary blood is gone here. I am relieving the pressure. So this capillary blood which is gone here, it should come within 3 seconds. If it is coming more than 3 seconds, means the capillary refill time which is more than 3 seconds, means it indicates the circulation to the peripheral part or the distal part is compromising. So the circulation decreasing means there may be a chance of the hypoxia, ischemia, and necrosis of the part. So that is the reason every 30 minutes we have to assess for the distal part of the our restraints application. Very, very importantly. Okay, and we have to ask for some tingling and any kind of the neurological impairment also. Okay, so and if we are applying the restraints here, because the patient may move hand with the restraints, so the skin may break here. So skin is skin is intact or not, so every 30 minutes we have to assess here. So that is the most important thing. Okay, it's very, very important thing. Remember, once the consent taken, it is valid for only 24 hours. After 24 hours you have to take the consent again. Okay, and without any order you don't have the rights to apply the restraints, and always restraints is the last choice. Okay, always restraints is the last choice to control the patient behavior. Okay, so that is remember, very important. Okay, so here's the next question. The question is, what is the first step in the primary survey of the trauma patient according to the ATLS guidelines? Okay, what is ATLS, sir? What is the full form of the ATLS? The ATLS is very simple. That is the Advanced Trauma Life Support. What is the full form of the ATLS? ATLS is the Advanced Trauma Life Support. What is this, sir? This is the a simple, basic, very important guidelines which we are using to take care of the patient in a mass casualty and the trauma. Suddenly, the 1,000+ patient coming rushing towards the hospital, or any mass casualty happen because of some rail accident, or because of some bus accident, because of some like Jatra Mahotsav. People know that in the village level, the people will celebrate there. Some collision happens. So the mass casualty means the many people are injured. Means at that point of the view, we are using the triage system and we are segregating the patient and we are applying these guidelines of the ATLS in the trauma. Okay, so also these trauma guidelines will be applicable for the road traffic accident where the patient comes because of the triaging and proper implementing the care with the base of the priority. Okay, so that is the very important. Here we are using the guidelines to take care of the patient who damaged by the trauma situations. Okay, so that is the very important. So ATLS is the Advanced Trauma Life Support. The full form the examiner can ask. Yes, what is the BLS? BLS stands for Basic Life Support. Okay, what is the ACLS? That's the Advanced Cardiac Life Support. That is the ACLS. What is the ATLS? That is the Advanced Trauma Life Support. Very important, bacha. The examiner can throw the questions, okay, on the ATLS sequence, on the BLS sequence and ACLS sequence. Okay, so what is that one, sir? Just now I told that's the Advanced Cardiac Life Support. So the prioritizing the care is different here. How we have to prioritize the care in the cardiac arrest and in the basic life support and advanced cardiac life support. I will discuss the difference between these two. Okay, so don't worry. But the sequence of the care in the our advanced cardiac life support and basic life support is same. That is the first we have to check for the circulation, and if no circulation, we have to just start the chest compression. Then comes to the airway. Then comes to the breathing. So this is the sequence we have to maintain in the ACLS and BLS. Okay. If in case of you are taking care of the patient with the trauma, that is the ATLS, Advanced Trauma Life Support. Here you have to maintain the sequence of the primary survey and secondary survey. In the primary survey, you have to maintain the sequence of the A, B, C, D, E. Okay, A stands here as the airway management and cervical spine stabilization. B stands here as the breathing, circulation, disability, and exposure and environment control. Yes, let me comes to the main question here and read the what examiner actually asking here. Okay, so what is the first step? What is the first step in the primary survey? In the primary survey of the trauma patient according to the ATLS guidance. Yes, just now I told in the ATLS, the primary survey, first one is the airway management. Okay, so that is the airway management, very important. Along with this one, the airway management with the cervical spine stabilization is the very important. Fix one question will come from this thing what I am explaining here now. What I am explaining here now, from here, the fixed one question will come in your AIMS, Norcet, prelims and mains and in your RRB exam, because it is very important, and some updated point also I will include in this one. Okay, so in the primary survey of the advanced trauma life support, okay, the first one we have to give the priority to the airway with the cervical spine stabilization. So what we have to do, if both airway management and cervical spine stabilization comes in the option, what we have to choose the first one. So first, just immediately stabilize the cervical spine. Immediately stabilize the cervical spine, then goes to the airway. Okay, so very important. Then comes to the breathing and ventilation. C stands here as the circulation with the bleeding control. Then option D is the disability. That is the neurological assessment. We have to go immediately here by using the AVP score and Glasgow Coma score. Then comes to the exposure and environment control. So in the last time in Norcet, they have asked the question, what is the in ATLS guidelines of the primary survey, what is the E stands here? The E stands here is the exposure and environmental control is the very important. And in the secondary survey, we have to assess for the history of the drug. Okay, history of the medications, history of the injury, and history of the allergies to the patient. Okay, then comes to the head to toe complete physical examination will be done in the secondary survey and imaging technique if necessary in the secondary survey. Okay, most important bacho, the A, B, C, D, E is the going to matter very important. The first step here, the examiner asked in the last question, the first step is always, yes, manage the airway and stabilize the cervical spine. Okay, so yes, the next question is here. What is the primary purpose of STAR system in mass casualty incidents? Okay, so just I have told what is the mass casualty, where the lots of the people, the group of the people are injured in a one place. So that is what we call as the mass casualty, right? So what is the purpose of this start? So what is the meaning of this start? Bacho, in the old guidelines, the start stands here as the simple triage and rapid transport. But now T here not as a transport. Now T stands here as the, that is the simple triage and rapid treatment. Okay. Wherever we have attended the all this ATLS programs, there everywhere they have told like this only, and it will come in the next update. It stands, the start stands here as the simple triage and rapid treatment, not transport. Previous one was the transport, now is the simple triage and rapid treatment. Okay, so very importantly, note it down. Okay, it creates the difference. The full form of the start will be asked in the exam. So whenever there will be a mass casualty, suddenly we have to go with the color codings. Okay, and we have to give the color codings to the patient based on the severity of their injury. If the patient is dead and he is unable to means he is in a situation where we can't make him to survive. Okay, anyhow the patient is going to die. Okay, that kind of the patient, already dead patient, and anyhow the patient want have to die within a few minutes or few seconds. So that kind of the patient we have to give the color coding of the black, and we have to prioritize them as the last priority. Patient is already don't have life, means there is no meaning of the caring to the patient. So we have to give priority to the other patients who are actually required the care. And if we immediately attend the patient's chance of the survival is more, so that patient takes the priority here. Okay, so that is what in the start we have to do, that is the simple triage and rapid transpose. Okay, simply we have to triage the patient, means we have to classify the patient based on the severity. The question came in the last exams like, so what is the meaning of the triage and how it works? It works by classifying the patients based on their severity. Okay, remember, right? So the next, the question is, what is the primary purpose of the START system in the mass casualty incident? Okay, the options are to treat the patient in order to order they arrive. Okay, so if the minor injury patient with little bit bruises on their skin, he came immediately to the hospital. So first we have to treat him. No. So the option is telling whoever come first, so treat them. They are telling no. It is not like that. It's treatment should be based on the severity. Okay, so to quickly assess and prioritize the patient based on the severity of the injury. Okay, so this is the primary purpose. This is the primary purpose of the our trials. Very important. Here the start full form is very important, and here the purpose of the our trials is very important. Then comes to the to provide the advanced life support to all patients. Why we have to give the advanced life support to all patients? We have to give the advanced life support if necessary only. Okay, then comes to the to evaluate all patients from the disaster area. Okay, we are not having that much time during the disaster to evaluate the all patient. It's not possible practically. Okay, so option D I am eliminating. Then and the correct answer of this question is the option B is the correct answer. Okay, so then comes to the next question. Which of the following describes a yellow color coded patient? Okay, this is yellow color coded patient. Our coloring system in the triad. So what all colors we are having is the Royal GB. Okay, remember R stands here is the red, L is the, that is our yellow, green and block. Okay, so this is the mnemonic Royal GB. Okay, so don't consider the O here, right? So R stands for the red, YEL is the yellow, G is the green, B is the black. So what kind of the patients we have to prioritize in the yellow? Option A is telling the patient who has no life-threatening injuries and can be treated at the last. Okay, so if patient is having no any life-threatening injuries, we are considering him last, means this will be prioritized in the green. Green will be our last priority. Okay, here the patient is having little bit minor bruises and skin injuries. Okay, there is no any major complication, so this is the green. Option B is telling the patient requires the immediate medical attention. Wherever the word immediate, wherever the word emergency it will come, so that indicates it is red. Okay, so then comes the option C. The patient has clear airway but need observation. Okay, so the patient is having the clear airway. Okay, airway is no problem, means it is not emergency. Okay, so but need just observation. So this patient we can delay for the treatment up to 1 year for 1 hour. Okay, so this kind of the patients we have to consider in the yellow. Okay, and the patient who have decreased, means the patient is already dead and no longer require the treatment. So this kind of the patient we have to add in the black. Okay, add in the black. Let's quickly revise all the golden point on the triage. Okay, so take a screenshot of this one, it actually helps you. Okay, triage color codes. So that is the red one. Okay, that is requiring the immediate attention. Okay, for this kind of the patients who is categorizing under the red one, if we are not attending within 1 hour, so means we will lose the patient here. Okay, so remember the golden hour. What is the duration of the golden hours in the trauma? So that is the first 1 hour of the trauma. Okay, first 1 hour of trauma is called as the golden hour. Bacho, one more thing, we will study the golden minutes in the neonatal resuscitation. So what is golden 1 minute? The first 60 seconds of the neonatal resuscitation is called golden minute, right? So what is golden minute? Golden minute is the first 60 seconds or the first 1 minute of the neonatal resuscitation is called as the golden minute. And here in the trauma, we are having the golden hour. That is the first 1 hour of the trauma is the golden hour. Okay, so here if we are attending the patient immediately, okay, so there is chance of the survival is more. So that kind of the patients we will add in the red. Okay, so because the patient are having the life threatening injuries, okay, which requires the immediate care, so it will be categorized under the red. And examples like severe bleeding is there, hypovolemia is there, shock is there. Okay, remember shock, and the breathing difficulties are there. So these kind of the patient will be categorized under the red. Okay, just now we have discussed about the yellow. Yellow is a serious condition but not life threatening. Okay, so we can delay the care up to 1 hour here. Okay, like fractures are there. Okay, moderate pain. Okay, no life threatening burns. Okay, then the clear airway. So these kind of the patients we have categorized under the yellow. Then comes to the green. Okay, so green is the minor priority we can say. Okay, so here the patients are having the minor injuries and non-urgent. We can delay the care up to 12 hours also. Okay, small cuts will be there, bruises will be there, sprains, strain will be there. So these kind of the questions, persons and patients we have to categorize under the green. Okay, so very important. Then comes to the black. Okay, already discussed the point. In the black, yes, so the dead patients will be categorized under the black, and injuries where a severity of the injury is in a such a extent that we are unable to save the patient. So that kind of the patients are also categorized under the black only. Okay, because we are investing the time in this patient where it is not possible to make him survive. So we are losing the time where the other patient if we attend early, they can survive, so they will also get lost. Okay, so it's very important. If the patient sounds and which looks like the patient, we are unable to make him survive, so leave the patient and go to the next patient. So here, if we are attending, that next patient may get survive. Okay, so that is the very important. The black is indicating already dead patient and about to die patient. So very important. And take a screenshot of this one or make a notes of this one. 2 times at least revise these things. It will be very much helpful for you all. Okay, so all golden point chanting we have done on the Triage. Okay, so the question also we have done on the Triage. And yes, very importantly, the meaning of the Triage we have finished. And in the advanced trauma life support sequence we have learned. Okay, so very importantly, then comes to the golden point charting on the ATLS airway management. So these particular question, what I'm saying here, it's a high yield and very important question. Okay, it's very important question. The question is, in the advanced trauma life support, what is the preferred method of opening the airway in a trauma patient who is having a cervical spine injury? The patient is having the cervical spine injury. So what is the preferred method of the opening airway? And if in case of the cervical spine injury, they may have given the road traffic accident case, or the patient may have the history of the fall, okay, fall injury, or patient may comes with the holding the hand, holding of hand to neck. Like the patient came here, sir, I have fallen from the bike and I am having the pain here. Like he have holded the hand, like here in his cervical spine. So if this kind of the scenario is throwing in front of you, people, means your answer is always and always would be the best answer. Yes, almost all you people have chosen the correct answer. There is the jaw thrust maneuver. Okay, if in case they have just given the trauma also. Preferred method of the airway management in the trauma cases, always head tilt, chin lift manner. And sir, we have learned that, sorry. So always in the cervical spine injury, road traffic accident, fall injury, holding the hand. Okay, patient came by holding the hand behind the neck, and in the trauma, the always preferred mode will be the jaw thrust maneuver. Okay, sir, we have learned that the head tilt chin lift maneuver is a preferred method of the airway opening while giving the CPR. Yes, so that is the correct word. But here the patient came in the cervical spine injury or the trauma. Here we are doing the head tilt chin lift like this, means look at the image B. If the patient comes with a cervical spine injury and I am putting his uh, head down and I am lifting his chin up, means I am tilting the chin and just putting the head lower side, means again his cervical spine becomes bent here. So it again creates, there may be a chance of creating the compression over the C4 nerve. Okay, if the patient got compression over the C4 nerve, so there is the cervical spur nerve. This is having the direct supply to the diaphragm. Okay, so this is having the direct supply to the diaphragm. So the diaphragm is the main muscle of the respiration. Okay, so it will be supplied with the phrenic nerve. Okay, remember the word phrenic nerve. Okay, that is the C4 nerve branch. Okay, so if the C4 is blocked, the phrenic nerve is blocked, the diaphragm paralysis happens. The main muscles of the respiration is got paralyzed, means the respiratory arrest will happen and the patient will die. So that is the reason this is not a preferred in the trauma. Okay, in the trauma, this is not a preferred method. Okay, look at this one. This is called as a jaw thrust method. We have to stand at the neck end of the at the head end of the patient, and we have to lift the jaw. Okay, we have to hold here and you have to lift the jaw, then slightly push this jaw down like this. Okay, so it will open easily. So that is what we call as the jaw thrust maneuver. It is preferred in the trauma patients. Okay, and in the trauma patients and in the cervical spine injury direct questions and patient with the history of the fall. Okay, so preferred is always the jaw thrust maneuver. Very important, bacho. Okay, So these questions may ask every time in the exams very repeatedly. Okay. So hope it's very much clear. So then comes to the image based questions. They can ask this technique. What we call this is the jaw thrust maneuver. Okay. So again, this one is the head tilt chin lift manner. Very important. Then comes to the image based question. Identify the image. Yes, identify the image what it is given in this particular board. I'm waiting for your answer in the comment box, bacho. Fatafat do comment for this. Fatafat do comment for this image. Yes, that is the laryngeal mask airway. So we can say this one as in the LMA. Okay, LMA method of the managing the airway. So that is the laryngeal mask airway. We call this one. So we have to put this one here directly over the larynx, and we can deliver the oxygen through this one. Okay, and it will completely covers our larynx, the voice box, and it helps to deliver the oxygen by bypassing the mouth and pharynx directly into the larynx through the trachea. Okay, so it bypasses the mouth and our pharynx. So we can use in case of the emergency airway opening techniques. This one. Okay, so laryngeal mask airway. Okay, this is the what we call as the Goodall airway or the oropharyngeal airway. Okay, yes, I think all you people know this one. Okay, Goodall airway. We can also say this one as in the Goodall airway, right? So what is the purpose of this one? The examiner asks the purpose. Main purpose of this one is, yes, can anyone wants to answer? Can anyone want to answer the main purpose of the Goodall airway? Yes, to prevent tongue fall back. In a semi-conscious and unconscious patients, the airway will get blocked because of our own tongue will go back and it will fall on our trachea. If the tongue is falling over our air entry area, so air will not go inside. So the airway will get blocked. So in order to prevent that one, we have to use the oropharyngeal airway or the Goodall airway. So it is main purpose is to prevent the tongue fallback. Very important. Okay. So insertion technique, measuring technique, everything I will tell while discussing the airway management devices in the 7th or 8th class. Okay, so don't worry, I will cover everything. Just the question came here as an image based part I am discussing here. Okay, so this one, identify the image. This is also image based questions may come. Yes, this is the what it is. It is the nasopharyngeal airway. Very important. Directly through the nose we can insert inside the pharynx. Okay, it will helps to deliver the oxygen. Okay, this is the nasopharyngeal airway. This is the Goodall airway or oropharyngeal airway. This is the laryngeal mask airway. So in the emergency, if any airway obstruction is there, so we can use this one, these types of the airways. Okay, very important. So then comes to the next questions. Okay, that is the what is the primary goal of the needle cricothyroidotomy? The temporary method of opening the airway directly through the trachea. So that is what you call as the crico, means below the cricoid, on the cricoid membrane. Okay, thyroidotomy means above the thyroid cartilage, below the cricoid cartilage. Here is the cricoid membrane where I am creating the opening here. That is the otomy. Okay, so what is the meaning of the otomy? Otomy means open. Okay, ectomy means cut and remove. Okay, yes, the ectomy means cut and remove. Okay, that is the appendectomy, means I am cutting and removing the appendix. Okay, so that is the appendectomy. Otomy means just open. Tracheostomy, coloostomy. Okay, means I am not just cutting and eliminating, just I am creating the opening. So that is what you call as the cricoidotomy, means just cricothyroidotomy means in below the Adam's apple, above the thyroid cartilage, here is the cricoid membrane. Okay, so we are inserting the needle directly here because my upper airway is blocked and I am unable to intubate the patient. I am unable to create another method of the airway management in the emergency in order to give sudden airway clearance to the patient. Just I am taking a one 14 gauge IV cannula and I am pricking directly. Okay, and remove the stellate. The air will enter through the cannula into the trachea. Okay, that is the reason why we are using the needle cricothyroidotomy. Okay, so very importantly, why we have to use this one to establish the long term ventilation? No, this is, as I told, it is a temporary. Okay, it is not long term, it is a temporary until the establishment of the tracheostomy 2. We have to use this one. This is only temporary and it is for the short duration, so I am eliminating this one. Okay, first I will show what is that cricothyroidotomy. Look at this one. First we have to keep the hand in the Adam's apple. Okay, Adam's apple. What is this Adam's apple? This prominent portion in the male. Okay, so this prominent portion in the male. Okay, this is what the made up of the thyroid cartilage. The prominent portion of the thyroid cartilage, which is coming prominently. This is what we call as the Adam's apple. Okay, so and just below that there is a cricoid membrane. Okay, this is a thyroid cartilage. This is the cricoid cartilage. In between here we are using the orange color IV cannula. The orange color is IV cannula is the 14 gauge IV cannula. Okay, so it is very important. Just I am inserting the 14 gauge IV cannula directly inside the our trachea through the cricoid membrane. So that is what we call as in the cricothyroidotomy. So this is the emergency procedure. If airway blocked and I am not having any options to create another airway, so just use this one as an emergency purpose. Okay, so to provide the temporary quick airway in the patients with the upper airway obstruction. So this is the correct answer. If the upper airway is obstructed for the temporary purpose, to quickly means immediately in the emergency, in order to establish the airway, we have to use this needle cricothyroidotomy. It's very important. Okay, so it is not replaces the ET tube. Okay, until insertion of the ET tube, we can use this one. Okay, it not replaces the ET tube. Then comes to the option D. It clears the secretion from the trachea. It won't create the secretion from the trachea. So this is also I am eliminating. The correct answer is the option B was the correct answer. Okay, so make a note of that one. So here is the next one. Next question in front of you all. Which of the following cervical spine immobilization technique is used for patients with a suspected spinal injury during the extraction from the vehicle? What it means? The patient is got a road traffic accident and we have shifted the patient in the ambulance. The ambulance comes to the hospital. Okay, so now I want this patient to shift from the ambulance to the hospital, means extrication from the vehicle. I am extricating the patient from the vehicle to the hospital. So while shifting this patient, what I have to use here? Option A, modified Trendelenburg position. Never ever give the Trendelenburg position in the spinal cord injury patient. Always flat position without any head elevation, completely cervical spine. Okay, on thoracic spine, everything will be in the straight direction. Okay, so that is make sure. So don't give the Trendelenburg position. I am eliminating the option A here. Okay, so then comes to the option B, cervical collar with a manual inline stabilization. Okay, so cervical collar I have to use. Okay, and manual inline this one stabilization means it will be completely flat like this. Okay, so it will be like this completely. Okay, this inline stabilization along with this one. So here will be a two hands will be there. So here we can hold the this handles and we have to shift the patient from the what we can say vehicle to the hospital. Okay, before that one we have to apply the cervical collar here. So this is what we use actual technique to shift the patient from the vehicle to the our hospital. Okay, so then hollow traction and log roll technique. So don't confuse. Many of you are choosing the log roll technique. Log roll technique is used to change the position. Okay, not to shift the patient from the vehicle to the hospital. Okay, just the patient on bed or on the floor. If you want to change the position, like from the supine to the prone and prone to the supine. Okay, just at that point of the time we have to use the lateral technique. Just don't worry, I will show the image. Okay, so this is what you call as the cervical collar. This is what you call as the cervical collar or the neck collar. Okay, so here it's supporting the our neck completely and keeping the neck straight, and it will not create the compression or the neck. Okay, so that is very important. So this is the image of the cervical collar. Okay, then comes to the, this is our halotraction. This is what? This is our halotraction. This is also used in case of the cervical spinal cord injury. In the post-operatively, we have to use this one. Okay, to relieve the compression on the cervical spine. Okay, so in the emergency, we don't have that much time to put the traction on the patient. Okay, so this won't be used in the emergency. This is elective procedure we have to done in the OT. Okay, so after the post-operative situations, in order to relieve the compression. Okay, so if any compression created, the pressure created, in order to relieve that one, so we have to use this one, halotraction. Very importantly. Then comes to the log roll technique. Okay, so remember the question, the golden point chatting. Okay, so how many persons required for the log roll technique? So for healthcare provider. Okay, so for healthcare provider required. Okay, maximum means 5 healthcare provider. Minimum means 4 healthcare provider. The standard at least 4 healthcare provider, maximum up to 5 healthcare provider required. Okay, how we have to change the technique? Note it down here. The patient is, okay, this is what I told, the inline stabilizer. Okay, so like it will be like bed, so we are holding the patient. Okay, and we are keeping the patient flat. Okay, so this is what we call inline stabilizer. Okay, note it down in the step 1. What happening? The 4 healthcare provider are 1, 2, 3, 4. Okay, in the step 2, one is completely stabilizing the head, and another one is holding at the shoulder and back, and two people one is holding at the buttock and one is holding at the leg. Okay, so while changing the position, everyone should turn the patient at the same time. Okay, and this person who is holding the head should not allow the head to go down here. Okay, he should keep the head straight only. And so then again, after the procedure, bring the patient again to the main flat position and leave him. Okay, so don't keep the patient in the lateral position by using the log roll technique. Okay, very important. This is what called the changing the position with by stabilizing the cervical spine. That is what we call as the log roll method or the log roll technique. Very important. It's a very important. Okay, so then comes to the if the patient is airway got blocked. Okay, if the patient airway is got blocked, so where we are using this mask. Okay, the image based questions will come. We are using this mask. This mask is called as the mouth to mask respirator. Means in case of the airway blockage, in order to create the breathing, here we have to hold our mouth with a tight sealed lip, and then this portion to the appropriate patient and hold with the E and C technique. Okay, then deliver the respiration through our own mouth. Okay, take a deep breath like this and blow directly into this mask. Okay, the air will go inside to the lung of the patient. Okay, so very importantly, and I have told to hold this mask, use the C and E technique. Okay, focus over this image. Focus over this image. Here C is created like, and here E is created. 1, 2, 3. Okay, so this is what we call as the C and E technique. So this is used in the holding the ambu bag mask or the mouth to mask respirator both. Okay, so very important. And here is the next question. Yes, fatafat revision because we are having the very last time. So this is what we call as the ambu bag. We call this one as in the ambu bag. The full form will come in the exam. This is the ambu means artificial manual breathing unit. Okay, this is called a ambu bag. Here the reservoir is there, so we can say ambu bag with reservoir. Okay, very important. So this portion we can connect to the oxygen cylinder, and oxygen will directly comes inside. Okay, when we compress the ambu bag, the concentrated oxygen will go into the patient. Okay, so just what I told, the EC technique, that is the C and E technique of the holding the mask. Okay, which will be used along with this mask also. Okay, if the patient is in the advanced airway like ET2, okay, if the ventilator suddenly not working means remove this mask. Okay, only this portion will remember. It will be directly fixed to the ET tube. Okay, so then directly we can push the ambu bag to deliver the oxygen to the patient. Okay, so very important. And the question will come like capacity on the ET tube. Okay, this is directly I have taken from my note. Okay, so remember, bacho, ambu bag capacity in the neonate it is 250 ml. So to remember, 250 ml is the only one and best standard answer. In range, if you are studying means, yes, it is from the 240 to the 750 ml capacity will be there. Okay, 240 to the 750 ml capacity will be there. Okay, one single best answer is the 250, and in the children it is 500, and in the adult it is 1000 to 1200. Okay, but single best answer is the 250, 500, and 1000 is the very important thing. If the examiner asking the amber bag capacity in the neonates 250 ml in range, that is the 240 to the 750 ml. Okay, the amber bag capacity in the children's it is 500 ml, and amber bag capacity in the adults, so that is the amber bag capacity which is used for the adult is the, yes, the 1000 to the 1200 ml. Very important. Take a screenshot of this one. Okay, so very important. So then comes to the next one. Next question. Yes, please do read the question completely carefully and try to give the response to the particular question. Yes, all emergency first aid, ATLS guidelines, everything will be covered. Image based questions, scenario based questions, OT, ICU, where downing, doffing, okay, ATLS guidelines, emergency, adrenaline emergency, okay, critical care, everything will be covered before going to your exam. Believe me, I will deliver a high yield content that is definitely boost your marks in your exams, right? So yes, so here is the question. When performing the Heimlich maneuver on a pregnant woman, where should you place your hand? Just tell me what is Heimlich maneuver. Heimlich maneuver is the maneuver where we are using to remove a particle or a thing which is obstructing the upper airway. Consider the patient is the child is having some seeds. Okay, accidentally it went inside and it obstructed his airway, and now the child is unable to speak. The child is choking. Okay, unable to breathe properly. So means the patient is in the state of the choking, means the upper airway is obstructed. So I have to remove that particular what we can say uh, seed or the thing which enter into the upper airway. So we have to remove that one. So first thing we have to insert our hand and remove. This is the crime. Okay, don't blindly swipe your finger. Okay, if it is superficial it will go inside, so don't blindly sweep your finger. Okay, so even if it is visible, there is designated what we can see instrument will come to remove that one. So first and best method is to remove that one is the Heimlich maneuver. So what is the Heimlich maneuver? The another name of the Heimlich maneuver is the abdominal thrust. Okay, so this is what we call as the Heimlich maneuver. Okay, in the adult how we have to perform this one. This is the Heimlich maneuver. Okay, this is the Heimlich maneuver in the child, but Heimlich maneuver is not performed in the infants and the neonates. Okay, so if the age is less than 1 year, so Heimlich maneuver is not performed. Okay, and in the unconscious patient, Heimlich maneuver is not useful. And the patient was suddenly collapsed, so Heimlich maneuver is not useful. To perform the Heimlich maneuver, the patient should be conscious. Okay, so that is very important. All golden point chanting I will do on the Heimlich maneuver. Don't have to worry. Just try to give the answer for this one. Yes. So if you are performing the Heimlich maneuver in the pregnant woman, so where we have to place our hand just above the navel. The navel means here is the umbilicus. If you are keeping the hand on the umbilicus and pushing, means the fetus will get damaged, the placenta will get damaged. So don't do this one. So the navel pressure is contraindicated. So don't do this one. Okay. Then option B is the at the center of the trachea. So here at the center of the trachea, you are pushing means like a patient will die. Okay. So don't do this one also. Then comes to the patient option C on the upper abdomen and lower chest. Yes. This is the lower abdomen. where the uterus will be there, where the fetus will be there. Now I can do over the upper abdomen. Yes, I can do over the upper abdomen. This is the upper chest and this is the lower chest. Okay, so lower chest, upper abdomen both are same. So I have to keep my hand here in the lower chest or up the upper abdomen and give the thrust. Okay, so that is the correct answer here. Yes, almost all people have chosen the correct answer for this one, right? Yes, very correct. So in the pregnant woman, where we have to place the hand in the on the upper abdomen or in the lower chest. Okay, so below the rib cage is the not correct answer. So our answer here is the option C. So let me start the golden point chanting on the Heimlich maneuver. Very important. Okay, very important. So first one we have to check for the universal sign of the choking. So what is the universal sign of the choking? Universal sign of the choking. Yes, the patient will be positioned like this. Okay, the hands are crossed and he will like say like this. He is unable to speak anything. He is unable to speak anything, and patient will cough repeatedly. Okay, and he is unable to breathe. Okay, unable to breathe, unable to cough, or not unable to cough. Yes, the patient is unable to cough because of the upper airway obstruction. The patient unable to speak and unable to breathe. So it's very important. So that is indicating the patient is having the choking. Okay, that is what you call the choking. The universal sign of the choking is the unable to speak, unable to cough, or unable to breathe. Okay, it's very important. This particular line asked in your exam. So I have brought this one. Okay, so yes, Bacho, very important. Yes, the first we have to assess for the choking. If it is choking means the patient will show the universal sign of the choking. That is the cross hand and holding the neck. Along with that, okay, the patient is unable to speak, unable to cough, and unable to breathe. Okay, so this indicate we have to initiate the Heimlich maneuver. Yes. So then call for help is the second best step, and then comes to the position yourself. So we have to position ourselves means patient have to stand in front of us. Okay, so we have to stand as a here is the healthcare provider. I have to stand behind the patient. Okay, so I will make a fist of the one hand and I will keep on the patient navel or the patient abdomen here. Okay, then I will take this hand. Okay, I will cover or grab this hand and I will give a like thrust inward upward like J shape. Okay, J shape thrust that should be very quick. That should be immediate. Okay, so it's very important. Bacho, here first hand I will keep and another I will grab with another hand and I will give a thrust in the yes J shape like inward and upward. So because of the abdominal pressure and the thoracic pressure, so it's created on the trachea and the thing which is there in the upper airway it will come out. Okay, so this is what we call as the Heimlich maneuver, which will be done in the upper airway obstruction. Very important. Then comes to the yes the position where we have to position. This is also asked a question, bacho. So stand behind the person and place the foot slightly in front of the in front, so to maintain the balance. Consider he is the person. Okay, he is the person with the airway obstruction. Now I am the healthcare provider. I am standing behind the patient. Okay, so then one hand I have to keep in between the patient. One leg I have to keep between the patient leg and one leg like this. Okay, so I will maintain the balance. Very important. So this is important. Then hand placement, I have already told, make a fist of the one hand and place that hand on the navel. Okay. So in the all adult patient, we have to pressure on the navel, means on the umbilicus, right? In the pregnancy, it is contraindicated. But in other all normal patients like adult and the male, okay. So here we have to place the hand on the navel or on the umbilicus. Okay. So and grab that hand with the another hand and give the upward inward pressure. Okay, so very important. So then comes to the next one, abdominal thrust technique. How we have to give the abdominal thrust technique? So this red highlighted point repeatedly asked one. Okay, perform the quick and inward and upward thrust. Okay, so thrust should be inward and upward. Okay, it will be in the J shape, right? Like this is the inward and this is the upward. Okay, very important. So then comes with the until how many times we have to repeat the Heimlich maneuver until the object come out or until the patient get unconscious and until the patient get collapse. Okay, so very important point. So till what time we have to continue the Heimlich maneuver? Until the object which is obstructed the airway which will comes out, or until the patient collapses, we have to, or patient goes to the unconsciousness. Till that we have to perform the Heimlich maneuver. Okay, so if the patient went to unconscious means he is unable to stand in his position, so it will be we won't able to perform in the unconscious patient. Okay, it is not useful in the unconscious patient. So very important. Then if the person becomes unconscious during the Heimlich maneuver, what we have to do? So we have to settle the patient on the ground first. Okay, keep the patient on the ground slowly. Okay, without any causing any damages. Then start the CPR. Very important. Settle the patient on the ground and start the CPR is the next best step if the patient get unconscious during the Heimlich maneuver. Okay, so then if the any obstruction which is visible, so take with the force of it out. Okay, don't do blind slap. Okay, just I'm inserting the finger and I'm doing the blind swipe means if the patient which came out also, if the object which came out also, which will also go inside. Okay, so don't do blind swipe on the airway. Okay, it's very important. So then comes to the next question again on the choking. Okay, in the choking in the infant. Very important. As I told, the Heimlich maneuver is not performed in the infants and less than 1 year age and in the neonate. Okay, so here we are having the another technique to perform the yes maneuvers to relieve the choking in the infants and neonates, especially in the infants. So these infants now they will not sit properly. They will won't sit in one place. So they will run around surround of the home. If anything falls to their hand, whatever it may be a battery, cell, coin, and any seeds, so they will put it on their mouth. Okay, so that is the only thing they will do. If they have put some coin or some seed means it will get obstruct the airway. So that point of the time, what we have to do is the yes, we have to perform the back slap and chest thrust. Okay, so that is very important and important technique. Let me revise the golden point and golden point chanting on the our black slap and chest thrust. Very important. So the question is asking while performing the back blow of an infant who is choking. So how should infant is positioned? So the position they have asked here. Okay. Option A is telling that lie the infant on their back on the flat surface means give the supine position. On the back, flat means the supine position. So it's not done. So I'm eliminating option A. Just a second, please. Yes, option B is that hold the infant face down, and your forearm with the head lower than the feet, chest. Okay, so head is lower than the chest. We have to hold. Okay, so yes, this is the correct technique. Look at this one. While giving the back blow, okay, so the face is down and our forearm, the child is resting on our forearm, and the head is lower than the chest. Okay, so look at this one. This is the straight. Okay, this is the head, this is the chest. Now the child is like this, means the head is lower than the chest. Okay, this is how the child is positioned during the back blow. Okay, the question is same. They have asked in the position during the back blow. So position should be done given in the back blow like this only. Okay, face down on your face should be down and on your forearm the child should be resting and the head is lower than the chest. It is the very important. So this is the correct and exact position what you have to maintain here. Okay, so let me revise the golden point chanting on the infants. Okay, under the 1 year of the age. Okay, with the choking, right? So here do not do the abdominal thrust in the infants. I told already if less than 1 year the abdominal thrust is contraindicated. Don't do that one. Okay, so then comes to the yes, instead of the delivering the back blows, instead of that we have to deliver the back blows and chest thrust. Okay, the question will come where we have to deliver the back blows. Okay, so let me clear all the thing and all the point. So lie the infant face down. First we have to take a patient to the position. Okay, the face should be down and the child will be resting in our forearm with the head is lower than of the chest. Okay, so this is what just now we have discussed in the question. Then comes to the how many back blows we have to give. the 5 back blows we have to give. So where we have to give? Between the infant's shoulder blade. Okay, between the infant's shoulder blade. So this is the right shoulder this side. This is the left shoulder blade this side, means the scapula. Shoulder blade here means the scapula. So between the right and left shoulder blade, here we have to tap here. Okay, so it is very, very important. Give the 5 back blows. Okay, how many back blows we have to give? That is the 5 back blows we have to give between the infant's shoulder blade or between the infant's scapula. Okay, almost 99% cases the coin or the seed which is obstructing the airway, it will comes out with a back blow. If it is not coming still, so then take a patient on your arm again, make a patient child face up. Okay, so now infant's child should be face up and give the 5 chest thrust like this. Okay, take a while giving the chest thrust with the 2 fingers, so infant's head should be down only and chest will be up only, but the face should be upward directed. Here the face is downward directed. Okay, look at that. While giving the chest thrust, the face would be upward directed and the head will be lower than the chest. Okay, again here also head will be lower than the chest. Here also head will be lower than the chest. The difference giving the back blow is the head is facing downward, and the difference giving the chest thrust is the yes, the face should be facing upward. Very, very important and mild difference that brings the changes in your answer. Okay, so using the 2 fingers below the nipple line. Okay, so the question will come where we have to give the chest thrust. So in between, just below the nipple lines. Okay, very, very important question. Then repeat until how many times we have to do this one? Yes, we have to repeat this one until the child become unconscious or until the airway become clear. Okay, if object come out, so leave that one. Okay, otherwise if it is not come out, so keep on doing until that object comes out. And so if the child become unconscious, then again the next best step is the yes, start the cardiopulmonary resuscitation. Very, very important. Okay, yes, so here is the next question. Yes, the next question is also very simple. According to the ATLS guidelines, according to the Advanced Trauma Life Support Guidelines, what is the first step in managing trauma patient with severe external bleeding? Okay, the patient came here with a severe external bleeding. So then what is the next best step or the first step according to the ATLS guidelines? What you have to follow here to stop the bleeding? Yes. Option A, apply the direct pressure on the wound. Option B, initiate the intravenous tranexamic acid. Bacho, this is the drug where we are giving to stop the bleeding. So this is what we call the injection tranexamic acid. So which we can use this one, like the scenario based questions will come. So which drug you have to keep prepared while doing the dressing, which is having the highest risk of the bleeding. So dressing with highest risk of the bleeding, we have to give the injection tranexamic acid, or in the clinical settings, we call this one as in the injection pause. What is pause, you know? So while playing the song, we will click over the pause button. Means just to stop. Okay, to stop the bleeding. So that is what you call as the injection tranexamic acid. Okay, so this injection tranexa, it will be used. Okay, but it is not first step. Okay, then comes to the elevate the bleeding side. Then is the apply tourniquet immediately. So this is the last step. This is the last step. After this one, we are having the surgical step. This surgical step is not a part of the ATLS guidelines. Means we have to open the artery or the vein which is bleeding, and we have to ligate that one with the surgical approach. Okay. So in the ATLS guidelines, the last step is the apply tourniquet. Okay. But examiner asking the first step. So then comes to the give the correct answer. So which is the correct answer? Apply the, yes, almost few people have chosen the correct answer. That is apply the direct pressure over the wound which is bleeding. Okay, so this is the correct answer. So I am clearing everything and keeping the correct answer in the highlight. Okay, so this is the correct answer. Okay, apply the direct pressure on the wound. Okay, very, very important. Then second step is the this is the first. and second one is the elevate the bleeding set. Okay, bleeding is happening here means I will elevate this leg. Okay, this hand means the arterial supply will get decreases. Okay, and the bleeding will reduces. Okay, then after that I will go for the compression dressing means I will keep the compression dressing here. Okay, so still the bleeding also not controlled means I will go for the tourniquet, where I have to apply the tourniquet. If this is the point where the bleeding is happening means distal to this one at the bony prominence area, I have to use the tourniquet and okay, I have to rotate like this. Means it will be such a tight that one both artery and venous supply will get blocked. Okay, so that is very important. Applying the tourniquet to stop the bleeding. Okay, so most important question. So then comes the next question. That is the which of the following is most commonly used size of the yes IV cannula in an emergency department for adults? Okay, for adults. So which of the following is the most commonly used IV cannula in an emergency department? Most common and preferred and most common and best IV cannula in the emergency is the 16th gauge. Okay, which color this one? 16th gauge will be yes, this color. That is the gray. Okay, before this one 14th also there. In some certain situations only we can use, but this is not preferred. Okay, the preferred one always will be the 16th gauge cannula. Okay, if the examiner asking which cannula is best for blood transfusion and for the pre-operative patient. Okay, so to give the anesthesia in the pre-operative area. Okay, so like IV anesthesia examiner, anesthesiologist wants to give some sedatives. Anesthesiologist wants to give means the preferred one is the 18 gauge. Okay, and best in the blood transfusion is the 18 gauge. Okay, so then comes to the 24 gauge, 22 gauge. Okay, so 24 and 26 will be used in the what we can say in the pediatrics. Okay, so this is the orange color 14 gauge. Remember bacho, the decreased number in the gauge, the increased flow in the rate. Okay, so जितना कम gauge rate gauge number होगा उतना बड़ा cannula होगा. Okay, if the gauge number is less, the cannula is big. Okay, so look at this one. So this is the yellow 24 gauge, but it is we are using in the pediatrics. You are using in the case of the pediatrics. So that is the yellow. Okay, so then comes to the 16th gauge, best preferred in the emergency situation in the casualty. Okay, so that is the very important 16 gauge. Preferred in the blood transfusion is the green one. Okay, green one is the preferred in the blood transfusion, and most commonly used in the hospital settings is the pink one. Most common used cannula in the hospital setting for the IV fluid. Okay, and for the antibiotic, IV antibiotic, the preferred one is the 20th gauge. Okay, and most commonly used one, overall most commonly used one is the pink one, that is the 20 gauge, right? So this will be the question. So sometimes the examiner can throw the question on you people based on the flow rate. Okay, remember bacho. So the orange one is the yes, the biggest cannula with 14 gauge. It is having the flow rate of the 250 to the 270. The single best answer is the 250. Okay, single best answer is the 250. Then comes to the second one. The flow rate of the our gray color 16 gauge IV cannula is the our 200 to 236. Okay, so the best answer is the 200. Then comes to the green color 18 gauge. It is 100. Okay, so then comes to the next one 20 gauge. This is 50 to 68 or 67. Make it 68. Okay, so the next one is the blue color, that is the 25 to 31, and the yellow one is the 13. This is the standard. Okay, so very importantly, how I have to remember this one, sir? 14, 16, 18, 20, 22, 24. 250, 200, 100, 50, 25. Make a half of this one and go on. Okay, so it will be helpful for you all, right? So 250, here the 200, then 100, then yes, that is the 50, 25. So 25 double 50, 50 double 100, then 100 double 200. Just you have to remember this one. That is, you can remember this one also 300 also, but the standard will be the 250 to 270. Okay. So if you refer many books, there will be difference will be coming. Just telling according to the AM standards. So what we are having and we are using that one. Okay. So that is the very important. And already we have discussed. So this one is the preferred in the emergency. This is preferred for the blood transfusion. This is the most commonly used in the hospital, and this one is the pediatric. Okay, so this is the pediatric. This is most commonly used in the hospital. This one is the blood transfusion. This one is the emergency. Okay, the question will come very importantly, and the green one also told for the anesthesia for the pre-op patient. Okay, most important questions. So then comes to the next question. That is the intraosseous route of drug administration is typically preferred in which part of the body. So, what you remember in the any emergency, okay, any patient who comes with a road traffic accident or any collapses, okay, like cardiac arrest comes means first we have to choose for the intravenous line. If we are unable to choose intravenous line, consider the patient comes with a road traffic accident, the hypovolemia happen, means all blood volume is lost, means vein will get collapse. Whatever, how much we try to found, the vein will not get. So then the second best route is the intraosseous, means directly we will take a needle and we'll push the needle into the directly bone marrow. Okay, so we'll take a needle and we'll put the needle directly into the bone marrow. This is what we call as the intraosseous route of the administration of the medication. Okay, same in the children with hypovolemia. We are not getting the vein. The next best and first method we are using is that is our intraosseous. In emergency situations, unable to find the intra veins, so then the next and best method and emergency method is the intraosseous. Okay, so while administering the epinephrine in the neonatal resuscitation, we are unable to access the umbilical vein. So the next best method in the route of administration of the epinephrine, if we are not getting the vein in the neonates, means again the intraosseous goes to the correct answer, means directly into the osseous, means directly into the bone marrow we are inserting the needle and we are administering the emergency medications, emergency IV fluids. Okay, so that is what we call as the intraosseous. But you remember, this is my bone, so inside the bone needle is going, means there is most commonly complication may arise, that is the osteomyelitis. So what it stands here? Osteo means bone infection inflammation. Myelitis means bone marrow infection inflammation. Okay. So osteomyelitis means infection and inflammation of the bone and bone marrow. So that is what we call the osteomyelitis is the complication may happens. Okay. So very important. Where we have to insert this intraosseous route, whether in the femur, whether in the ulna, whether in the radius, whether in the tibia. So the best answer is the tibia. So in the tibia also where, sir? Where means upper 1/3 of tibia. Okay. In the upper 1/3 of the tibia, we have to insert the very important our needle. Consider this one. Look at this image. So it is giving you a correct answer here. This is the tibia bone. Okay, this is the femur, the longest bone, the strongest bone, the femur, and this one is the patella here, the knee bone. So then comes to the tibia here. Okay, this is the fibula. The down one is the fibula. So this one is the tibia. So here this is the complete length of the tibia. This is the three equally we have to divide this particular tibia. Okay, so first one I am dividing upper 1/3 part, middle 1/3 part, and lower 1/3 part. So here in the upper 1/3 of the part, okay, so in this tuberosity of the tibia, so we are inserting the needle. So this is what we call as the intraosseous method of administration of the medication. Okay, so very important. So the best route is the tibia. Okay, this will comes in your exam, bacho. It's very important. Okay, so then comes to the next question. Next question, फटाफट revision. Yes. So in emergency situation, okay, the most commonly used site of the central line insertion. Okay, so what is the central line insertion mode we can use in the emergency situation? Bacho, remember the answer. Remember the answer. That is, yes, if anyone wants to answer for this one, yes. The jugular vein is not prepared in the emergency. The femoral vein is the best in emergency. Best in emergency is the femoral vein. So consider a few more golden points on the femoral vein. The femoral vein is mostly preferred only in case of the emergency. Otherwise, it is the least preferred vein. Why? Because if we are inserting the catheter in the femoral vein for the routine patients, means it increases the chance of the infection. Okay, so that is already we have discussed. So central line associated bloodstream infection, that is the Classea. Okay, so already we have discussed. Most common and highest chance of the Classea will be there in the femoral vein central catheters. Okay, but if I am inserting the central line in the subclavian vein in the emergency situation, means here this is the below the clavicle, we call this one as the subclavian vein. Okay, so this is the heart. Okay, here is the clavicles are there, clavicle bones. Okay, so this is the sternum, and here would be our superior vena cava, and here will be our subclavian veins. Okay, so this is the clavicle bone. Okay, below the clavicle bone, here we are having the veins. So these veins are called as the subclavian veins. Okay, just below the subclavian veins only. So we are having the lungs like this. Okay, so if I want to insert the central line in the emergency, means if suddenly if the needle will go into the lung, means it increases the chance of the pneumothorax. The question will come. Let's repeat the golden chant. Yes, the most common and highest risk of the central line which causes the pneumothorax is the subclavian root. And take another golden points in the subclavian root. The least irritable site of the central line insertion. Least irritable site of the central line insertion is the our subclavian. The most preferred route in the TPN administration, that is the total parenteral nutrition administration. You want to insert the central line, means that is the subclavian route. Okay, so the route where we are inserting the central line just below the clavicle is the subclavian route. The route with highest chance of the pneumothorax, that is the subclavian route. Okay, and take a situation based question. In the planned total parenteral nutrition, the nursing officer inserting the central line to the patient. During the insertion, patient found suddenly dyspnea, breathing difficulties. So what may be the expected thing happened here? There is the pneumothorax. And what is the next best immediate step? Yes, next best immediate step is the take a X-ray, confirm, then relieve the pneumothorax. Okay, very, very importantly. So the first we have to give the, yes, the Fowler's position, then we have to go for the X-ray, then we have to go for the relief of the pneumothorax. Very, very important. Okay, so then take a next again golden points. Just we have discussed the 4 points on the subclavian one. Least irritable, most preferred in the TPN administration, and can't preferred in the emergency, and highest risk of the pneumothorax. That is the 4 important points on the our subclavian central insertion catheter. Then comes to the our this one, right internal jugular vein. Okay, so right internal jugular vein is the previously best one. Now it is not best one because the patient neck movement and restriction it will create. So this is also we can use, but here also the patient will get irritated. So that is the reason right internal jugular vein will be not preferred in the emergency also and in the usual also. Okay, so but a best site of insertion is the examiner asking, means that is the right internal jugular vein is the best site. Okay, the least best and the last priority is the femoral vein, but in emergency the best site of insertion of the central line in the emergency is the our femoral vein, because it is having the less chance of the any kind of the complication. Okay, but if you want to use this femoral line, if you want to use this femoral line for long term means, so it is having the risk of the creating the deep vein thrombus. It is highest chance of the infection. Okay, so I hope it's clear to you all, right? So the risk of the infection is there in the femoral vein, and risk of the DVT is there in the femoral vein, and best in emergency is the femoral vein, and best for the TPN administration, that is the total parental nutrition administration, is the subclavian vein, very very importantly. Okay, so these are the last and very important golden points revision we have done in the many important questions that is going to strike in our exams, bacho. Yes, so as all of you know that we are doing the rapid revision, so where we have discussed a lot of things today. Okay, so note it down, many things we have discussed today. So every point what I have discussed is the very important, and golden point chanting and rapid revision of the thing, that is definitely helps at the last bacho. As I told, we are having a, yes, a very important announcement, that is on the Norcet 8 test series, Vande Bharat test series, and Sure Selection test series. The Sure Selection test series is both for the RRB aspirants and for the Norcet 8 aspirants, and Vande Bharat test series is for the only RRB aspirants, and Norcet 8, the booster series, is only for the our Norcet 8 aspirants, where we are giving the 95 test papers, including the mains and prelims, which is completely designed the same of the our Norcet 8 pattern, where we have created the 5 sections. Each section, first 4 section will be same like the Norcet pattern, which is nursing questions will be coming. Okay, at the end of the 5th section, the non-nursing questions will be coming. And in the CRE, we have last conducted the exam, where we have struck the maximum number of the non-nursing questions in the exam. And yes, and many few questions, very few questions which have struck from the all test results, but in that one we are the maximum. Okay, so like staining methods and vaccine question like on the hepatitis B vaccine and TB drugs, all questions on the TB drugs, and 6 to 8 questions on the HIV medications and pre-exposure, post-exposure prophylaxis, and EDTA while related question. Everything question which is directly came from our test series. So that is what, when experts create the thing and when experts make you to practice, that is helpful for your exams. Okay, so if you want to be a good ranker, so please do download our Master Nursing Classes app and do practice the test series with the updated knowledge and improve your skill. Focus on the time management also. Okay, focus on the negative control marking also. If you are still lacking with the negative control marks, so there is designated video with the practically possible things I have told in the negative control. So if people can watch those also. Okay, so it's there free of cost in my YouTube only. And downloading the app, all you people have to do by the clicking the link which is there in the description box and comment box both. Okay, so if you want, so please do download the Master Nursing Classes app, so which will be helpful for you also, right? We'll meet in the tomorrow's class again with the golden point sessions. Okay, definitely from the today's class 2 to 3 questions will come. After the exams I will come with a screenshot in front of people, बच्चों मैंने बोला था, right? We'll meet again. तब तक के लिए जय हिंद, जय भारत.